Awesome. Thank you all for joining us for this month's Roundtable Live. It's actually the Public Health Roundtable Live. And we're joined by an amazing panel of guests here, public health professionals. We're going to be discussing the topic of community focus on National Minority Health Month. And there's a lot for us to chat about and unpack. So we're pretty excited to dive into it. Let's start with some introductions just to make sure that everybody can. And I feel like we're having a little bit of an internet delay, so hopefully it's not too much of an issue. And for LinkedIn, I know there's a little bit of a delay from when we're recording to when it's actually live, but we're going to keep going here. Hopefully it works. Where I am here in the southeast of the United States, we've got some storms moving through, so it may be on my end, but hopefully it holds up. So let's do some introductions and we'll dive into our topic. I'm your host. I'm Dr. Charlotte Huntley. I'm the CEO of Dr. CH Huntley LLC. And there's kind of two parts to the company here. We are a consulting firm and we serve large nonprofit organizations that are serving BIPOC communities. And those organizations or companies that are genuinely interested in serving BIPOC communities. And on the other side of our business, we support public health entrepreneurs. In fact, we this week just launched the Public Health Entrepreneurs podcast. So that's a little bit about me. Let me kind of hand over the mic to Andrea. I'll go to you next. Introduce yourself.
Hi, everyone. My name is Andrea Lowe, and I own and operate the Social Impact Studio Consulting LLC here in beautiful central Pennsylvania, where it's also kind of rainy and stormy today. And I work with nonprofit and government agencies to help increase their impact as they through strategic planning, policy development, and strategic program reviews. It's nice to be here today.
Oh, thank you for that wonderful introduction. And we'll move right over to LaShonda.
Hello, everyone. My name is LaShonda Richardson, and I am the founder and CEO of Emerge Public Health and Community Development. Emerge is designed to educate, motivate, empower, restore, grow, and evolve. I am a public health consultant that works with businesses, organizations, and communities on health promotion, program planning, and resource evaluation. I also work heavily in community events and planning, hosting, and facilitating community health and wellness events. So I'm very happy to be here today as well.
Thank you for that. Happy to have you here. And also, new to our panel is Judeline. Welcome and introduce yourself, please.
Thank you. Thank you. My name is Judeline Casimir. I am the CEO founder of Casimir Public Health Empowerment. We're a company that focuses on community health research. So we help communities assess, plan, implement new health programs for a healthier community. On the other side, I'm also a public health educator. So I take pride on educating people on various health issues surrounding us because public health is the way of life. And I'm happy to be here today.
There we go. Wonderful. Thank you for that introduction as well. We're excited to have you join us. And to anyone who's in our audience live, please engage with us in the comments. And even if you're watching the replay, we're excited that you're here, whether you're live or watching the replay. It's really an honor that to have you join us. We're excited about that. But we also want to encourage you to comment, respond to things that we're saying, and keep the conversations going. We can't reply in real time, but we do always go back to the comments after we finish the live and engage. So this is a conversation that can continue on, far beyond this live streaming recording, all right, or this live streaming event. Okay, so once again, we're talking about, and I'll add it here for those that may kind of show up at different times. We're talking about this community focus on National Minority Health Month. So I've pulled up a little bit here that I want to just kind of introduce this concept, I guess. April is National Minority Health Month, and this yearly observance builds awareness around health disparities and the persistence of it among, racial and ethnic minority and American Indian Alaska Native populations, and encourages everyone to take action to end these inequities. So we can take that as a springboard for this discussion. And it really is about, what does this mean to you? Because really, if we start thinking about and breaking it down, how do we define communities and how really defining a lot of these elements? But I think it's important to have this focus and to have this conversation. So, my question for our panelists today is, I'm looking at notes. So, you see me look off to the side. That's why. How are you leading and engaging in minority health awareness conversations with communities that you serve? So, I'm going to just share just a little bit from my own perspective. As I mentioned in my introduction, I serve BIPOC organizations, or organizations that are serving BIPOC communities. So Black, Indigenous, and people of color. And this is really important to us as an organization, as a team, because these are, minority communities, or communities of color are often, hit hardest, hit first, suffer the greatest. And often there's a number of things, a number of elements that come into play when we're talking about improving the focus and reducing these disparities. I'm realizing here recently, what surfaces a lot is holding space for conversations, being heard. And it's not me speaking to them and them hearing me, but me holding space for them to speak and be heard. And that yields a lot, uh, improved trust, communication, and understanding truly what the challenges are, and not making assumptions about what I think they are. So, with that, I'm going to just kind of leave it right there. I'm going to pass over the mic to Andrea and ask you to just share your perspective. How are you leading and engaging in minority health awareness conversations with communities you serve?
Sure. So, as I was thinking about this question over the past week or two, I really started thinking about how important minority health is to me personally as a minority, a woman of color, and how I've been, like, my health has been improved, and my well-being has been improved through the investments of other people of color, through my groups with my communities of consultants, through mentors and friends and colleagues, through my professional and my personal life. And so for me, it's just kind of like, it's been focusing on those relationships, allowing me to be built into through like meeting with others and connecting with others and learning from them, and growing and honestly making mistakes and then coming back from them. But then also for me to be able to build into others as well, particularly other people of color who are consultants or are working in the field, and being able to help them grow and support their career development as well.
I really appreciate that perspective. A similar situation as you, in this space. I think as business owner and entrepreneur, it can be a lonely space regardless. And then when you start adding the layers of, being female and being of color, it just adds a little more complexity. And I really appreciate that focus and that shift and that importance of health, and how do we manage so many of these things to keep prioritize our own health, and supporting each other. So I really appreciate that. So, LaShonda, same question for you. How are you leading and engaging in minority health awareness conversations with communities you serve?
So, as to what Andrea was saying, being a minority, it's a lot of times personal because you have so many family and friends that deal with some health issues and things of that nature. So, it becomes a bit personal when wanting to make sure that people have the resources that they need to make informed decisions about their health and wellness. So, that is actually a part of what I do and why Emerge was founded, because I want to make sure that individuals in the community have concise resources that they are allowed that they can use that will allow them to make informed decisions. So when working in communities, just making sure that people understand the information and that they, and also listening, leading by listening. So making sure that, I think listening is very important when you're working in the community. You can have people from lower levels of education to higher. So making sure you're listening and that you're connecting with people on each each level, just to make sure that the resources are understood, that they know what they are and how to have access to them. So I would say lead by listening and ensuring that information and resources that are available are very well understood, so that they can make those decisions about their health and wellness.
Really important. I think that it's interesting how you bring that up, and I think we know this, and oftentimes it can be overlooked because it's like, oh well, we need to make sure it's understood, but that becomes a bigger problem sometimes. Is well, how do we really know, and how are we ensuring that, and is that prioritized? Because we can think that oh, it's really clear as we're handing it out or sharing it, but is it really falling on ears and with the clarity that we think we're leading with? So that's really important points you brought out. So, Judeline, what about you? Same question. How are you leading and engaging in minority health awareness conversations with communities that you serve?
As a public health educator, advocating ally for health equity, so I'm very passionate about raising awareness about healthcare literature. So one thing I notice, a lot of people, they do not know a lot of the terms, and they go to the doctors, they tell them about their conditions in a term that they cannot even pronounce, let alone remember it. So this is why I always tell you, I love educating people. So I love empowering people, educating them with the knowledge that they need to make informed decisions for their health. I also teach the minority communities how to advocate for themselves, ask questions. I tell them that the providers, the nurses, everybody's there for you. If they tell you something that you do not understand, you do not know how to take your medication, you do not know what it means, you need to ask further questions or have somebody here with you. For example, I work a lot with immigrant population because this is who I am. I'm an immigrant. And one of the main things they have is language barrier. They do not, some of them, they just came here, they don't understand English, or they have little to no understanding. So I make sure they have people with them when they go to their doctor's appointment, because after you leave that office you can never go back and ask questions, most likely. So that I have to make sure they have somebody there with them. And I sometimes I even type questions for them to ask providers what they need to ask and how they need to advocate for themselves. For example, you have people saying that, hey, I have a headache. The doctors just say, hey, okay, take this. But you might think the headache is associated with something else. I don't sleep at all. Like, so I ask them to make sure that they put it's a puzzle, put together the pieces so you can have a better outcome for your health. I, this is what I do. I educate them and I take pride in that.
I think that's important, and you raise a really good point because even native to this country, native English speaker, I can go into my doctor's office and be overwhelmed in a matter of a few minutes and come out like, okay, what did they just say again? So that's real. That's very real because we're in the moment. There's so much happening, and there's so much that needs to be packed in there. So just helping people understand those questions in advance is something I used to share with my mother all the time. Have your questions ready. Have a list going as you're going between appointments so that when you get to that visit, you're ready to ask those questions. I would love to kind of go back to each of you when Judeline, you gave some really good example there. So I'm kind of going to circle back to LaShonda and then Andrea. LaShonda, in your work with, and I know you work with a lot of focus on diabetes awareness within the community and the events and so forth. And you talk about listening and so forth. Can you give an example of some of the things that you're doing, like with your community, maybe with the events, and how that's helping to address some of these, the conversations around engaging minority health?
Absolutely. So, yes, specifically around diabetes, I have had diabetes awareness events where I brought in a physician assistant that talked about a diabetes reversal formula. And so I think in these events, it's also allowing people to know that you have a choice. Because when you think about diabetes, a lot of like type 2 diabetes is preventable. So just allowing people to know that you have a choice, that if you can make some lifestyle changes, small lifestyle changes, and create better habits that you may not have to take this medicine that you can't afford. So it's making sure that people understand that in certain, we know that certain things are genetic and some things are passed down from family lines, and we can't control that. But in those areas that we can control, that you have a choice, and making sure that they understand what those choices are and what the resources are to make better choices so that they can make better decisions for their life.
Yeah, that's really good. Andre, I'm gonna ask you the same because I like your kind of twist and take on this topic. Can you go a little bit further and give us an example of how this plays out for you?
Oh, sure. So I have a number, like I have an accountability partner who's also a Black female consultant, and we meet quarterly just to check in on our business goals and how we're doing, how we're addressing. I'm also working on my doctorate in public health, and so I have a mentor that I check in with monthly who like encourages me, is keeping me straight so that I will graduate hopefully next year. And then I have also a couple of groups that I meet with regularly. One through a fellowship program I completed a couple of years ago through an ASTA called the Dell Fellowship. And we still meet 2 years later monthly and just chat, check in with each other, all people of color from all over the country, and just kind of encourage each other in our work and help each other network. And then finally have a group of women as well that we meet with regularly through another fellowship program I had. So it's just like really just putting those time on the calendar so that you have that FaceTime with folks, because there's nothing like just chatting with folks and getting connected with them in that way to build yourself, but then also build others.
I love that. Love all those examples and such a great point. And I think, you know, what I'm enjoying from hearing from each of you is not only how we're serving our communities through the work, and of course that comes very naturally to a lot of us, but the shift because we need to also prioritize ourselves and our own health. And if we're not strong enough and taking care of ourselves, then we really don't have anything to pour into our communities. I like all of the examples that you shared, Andre, and that's really important. So not only the, kind of the community that supports us as we are, whether you're professional circles, but in this case, entrepreneurs and consultants circle, really strengthening you with this community of color, and then also the outward communities that Judeline and LaShonda shared about. Really appreciate that. Given all those angles. So let's take just a couple of seconds here, I guess seconds, a couple moments. I try to be mindful of our roundtable live during sort of a lunch break. So I don't want them to be too lengthy, and I'm always trying to pace the conversation. So as we begin to wrap up, I just want to kind of go around one more time and let each of you share any final thoughts or takeaways from this conversation before we wrap up and say goodbye for this month. And we'll start with you, Andrea.
Sure. And I think my final wrap up is really just make sure you take care of yourself, especially as a person of color through this month and throughout the year in whatever field you're in. Just really encourage you to take care of yourself as well as giving to others.
Yeah, appreciate that reminder. LaShonda, what about you?
I think my takeaway, especially with this being Minority Health Month, the theme for the month is be the source for better health. And so I think my takeaway or my challenge for us as public health professionals is being the voice that the community needs, and partnering with the doctors and the other healthcare professionals, and just being making sure that we are, if we have a resource, if we have stuff that we can share to the communities, to organizations, and partnering just to make sure that we are giving people the opportunity to have a resource to make better informed decisions about their health and wellness.
That was great. Thank you for that. And Judeline, what are your final thoughts?
My final thoughts and takeaway: people need to advocate for themselves, look for help when it's needed, especially mental health is very important. We have new mothers, we have mothers with toddlers. We need to check on our friends, check to see how they're doing, and make sure that we have each other's support, we have each other's back, because we all need each other.
That's wonderful. It's a perfect way to tie it all up. So, thank you all for joining me for this. Well, thank you to my panelists for being here for sure. And thank you for everyone who joined live and also watched the watching this replay. We appreciate you and we look forward to engaging with you in the comments. I guess one final thing I would like to share is all of our names are on the screen. So if you're not already connected with us on LinkedIn, make sure that you send a request, connect with us, and we invite you not only in the chat and the comments, but if you feel like you'd want to pull the conversation out to something a little bit more direct regarding any work or ways that we're able to support you, you can send us a direct message and we'll go from there. All right. So we'll see you all next month on the Public Health Roundtable.